most sensitive part of a lady, okay, in her genital organ is the clitoris. Now, in case you don't know what the clitoris is, it is that protruded portion in a female genital structure, okay? That part that just protrudes a little in the upper segment. I believe I'm talking to people who are aged 18 and above. If you're under 18, please pack one side. Now, that is the most sensitive part when it comes to the female genital structure. I'm not talking about the upper body, I'm talking about the lower body. You get it? When this is tampered with because of this barbaric practice, that is female circumcision, and they cut that the clitoris, what will then happen is that there will be less pleasure when it comes to the other room. Now, a woman will not even feel like something is going on. She can even be reading newspaper and her husband is there or her partner is there, doing the most, touching every touchable. She can be reading newspaper, she can be pressing her phone, and she will not feel anything. That is the damage that female circumcision can do to a lady. That is to that extent. If the clit, which is one of the most sensitive parts in the female genital organ, is cut off. Number 2, less natural lubrication. Yes, you heard me well. Have you ever wondered, where does lubricant, wetness actually come from when a man stimulates his woman during foreplay? Where does this wetness all of a sudden come from? It is from 2 tiny glands situated on either sides of the VJ of a woman. So this is a woman's vagina. On either sides of it, on the both sides, there are tiny pores there that are glands situated specifically to do what? To bring about wetness during sexual pleasure, intercourse. All right? Now, these 2 are called the Bartholin's gland. If anything at all tampers with this gland, either by way of female circumcision, maybe they actually try to cut the labia and sew some parts together, and by so doing mistakenly they closed up that tiny hole. I mean, it is so tiny that it takes you as a medical personnel to be able to actually observe it. As a layman, you go look tired, you don't go see him, but it is there, and its sole function is just to actually bring about lubrication. Now, assuming that is closed, what do you think will happen? A man will struggle and struggle and struggle. Every time the woman will be dry, no matter how he tries to stimulate her, because the Bartholin's gland is closed up. It has disappeared. What was supposed to cause lubrication to happen is no more there. So what do you think? It might not be that she doesn't feel. She might feel, what you're doing. She's all excited and carried away, but she might not get wet. So, Oga, even if you like, stroke her for 1 hour, water no go pour. Do you get it? So the earlier you begin to actually discover your woman, know her in total, like what is your history? Have you actually had this before? The better for you. You begin to know, okay, there is no need wasting my time to do this for hours because there's not going to be wetness. What can I do in place of this? Number 3 is pain during intercourse, popularly called dyspareunia. Now, this is an extreme form of pain instead of pleasure. So a man, your husband, your partner, your fiancé, your boyfriend is actually penetrating into you, and you as a woman, all you feel is pain. I mean, you literally cry all through. And he will begin to wonder, what is going on? Are you not enjoying it? Am I not doing it well? Am I too big for you? Do you get? And you begin to say, you will say, no, I don't know, I'm just not feeling it, I'm just, and this can turn a man off in the other room. That is, sincerely speaking, it can turn a man off, because some people don't want to see you suffer. They love you enough, not to see you suffer, not to see you cry. So instead of you crying during intercourse, something that should have actually brought pleasure to both of you, you are crying. They would rather actually leave you alone, but that's not the best, because inside of them, they too want to be satisfied. They too want to actually make memories, pleasurable memories with their spouse. But in a case where she's always crying, what do? Okay, so this pain comes as a result of formation of scar tissue. So let's assume you have an injury on your hand, maybe you had a cut. When it heals, there is a scar that will be formed there. Now let me let you know that the skin itself is elastic in nature. So when there is a cut, okay, and there is a scarf that forms around there because it has healed, that part of that skin will no longer have the ability to stretch. Okay, that is how the female genital organ is. The vagina has the ability to stretch. Have you wondered how the head of a child comes out through there during labor, and after that it recoils back again? Otherwise, after delivery, you should have been like this now, like a river Niger or river Benue. But after childbirth, it recoils back again. So that is the vagina having the ability to stretch, the skin around there having the ability to stretch. But when that has been cut because of female circumcision, okay, and actually sewn together, some people actually sew the opening of the vagina of their female children. It's leaving a small hole just for menstruation to pass through, because they don't want them to ever get involved with a man while growing up. They want to reduce promiscuity. So if that happens and that woman grows up and scar tissues are formed there and the man is trying to penetrate her, what do you think will happen? It's going to be painful, because the skin around there will no longer have the ability to stretch to accommodate the incoming male structure, the incoming penis. That's what's going to happen. Another thing is phobia for sex. So imagine a lady who has actually gone through this trauma. She knows that each time the man penetrates her, she's going to be screaming of pain. Each time a man tries to arouse her, she does not get wet. Each time a man tries to touch her, she does not even feel it. There's going to be this anxiety towards sex. So each time a man even makes a move or mentions it, she can start being scared, in as much as she wants to do it to please her husband, but she's going to be afraid. Oh God, what am I going to, I'm just, there's just this, you just clench your teeth together because you know that what you're about to go into is something that will bring you nothing but pain. But it shouldn't be like that. This can ruin a woman's sexual life completely. I've seen women that do not even sit down and feel the urge for sex because of female genital mutilation. Yes. They don't sit down and feel the urge. They're just there. If it happens, it happens. And I'm just doing it to please my husband. I don't enjoy it. Sex was meant to be enjoyed. It was meant to be fun-filled and pleasurable. So if you do not enjoy it, there is no need to even engage in it. Now, quickly, let me say this. To those people out there who are still practicing this in their culture, I'm here to discourage such barbaric culture. It is not good. Let a girl child grow into an adolescent, and from there, let her grow into womanhood. And she will decide. If you guide her aright, she will be able to make good decisions. We make mistakes to be able to now learn and become better people. So when you close that up, you are risking her. You are exposing her to a lot of things that in future will now ruin the happiness she was supposed to experience. And now to the men. In case you have a girl, you have a wife, you have someone you want to marry, who you have observed that she doesn't have the urge for sex. Even when you go to touch her, she does not feel wet. She always cries of pain during sex and all of that. She does not get wet. What do you do? Number one, you have to be patient with her. There has got to be this open communication between both of you. Okay, babes, I've observed that each time I touch you, you don't flow. You don't feel wet. You don't feel the whole thing. You don't get wet. Do you want to talk about it? So there's got to be this open communication between both of you. What is going on? And she might not tell you, oh, I was raped before. Oh, I've been circumcised before. Oh, I haven't got a clitoris. Do you get it? Now that makes the man now think, oh, okay, yeah. After that open communication, the next thing is to be patient with her. You have to be patient. So each time you want to actually engage in sexual activity, your aim is not for your pleasure immediately, or just to penetrate and do your thing. No, your aim is for her own satisfaction. So you're going to ask her, what else can I do? Are there areas that your body is sensitive, to touch, that is sensitive to touch? It could be your ear, it could be the neck, it could be the breast, it could be the thigh, it could be any part of her body other than her vagina. Do you understand? So get to find out what other area turns you on. So I can actually spend more time within those areas rather than thinking it is down below. Because for those who are circumcised, down below does not stimulate them, it doesn't fit them. Number 3, you can talk about using an artificial lubricant. If their Bartholin's glands was sealed up because of this genital mutilation and they can never get wet, you can actually use artificial lubricant, not your saliva. We have lubricants, you can walk into a pharmacy and buy it. Those lubricants mimic natural lubrication, so that she and you can also enjoy the whole pleasure, and there will be reduced level of pain. Take it slow and easy on her. It doesn't mean that people who have been circumcised can never enjoy sex. This is me, I've come to embrace my future. No, something can be done. Artificial lubrication, a man being patient with you, lovingly walking with you through the process. You get it? And discovering the uniqueness of his own woman. What other areas can turn her on aside her clit, aside her vagina? Do you get? And you will enjoy sex.